Good morning.
Good morning, everyone.
Good morning, Melissa.
Good morning.
Morning.
They say good morning, Lisa.
Good morning.
Good morning, everybody.
Good morning.
Are we
Good
ready?
morning. So which one is?
Buenos dias.
Good morning to everybody.
Hmm.
Only the council. Oh, as far as viewing them,
Yeah.
I don't believe so. Non-participant. Show participant.
Hey, Anthony,
Yes, I can do that.
we can do tomorrow.
We're gonna do, are you here all day?
Today, yeah.
You're here all day.
Abraham, please mute yourself. Thank you. Mayor, I think we're ready whenever you are.
Okay, thank you. I call the meeting to order at 9:02. If you can please all rise and join me in the flag salute.
Mhm.
I pledge allegiance to the flag of the United States of America
America.
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. May all be seated. City Clerk, can you please take the roll call?
Mayor Lopez,
Present.
Mayor Pro Tem Ibarra. Here. Councilmember Davis,
Here.
Councilmember Menke,
Here.
Councilmember Gonzalez.
Here.
You have a quorum.
Thank you. City Clerk, do we have any changes to the agenda today?
There are none.
Okay, may I have a motion to approve the agenda?
I'll move.
Move second.
I'll second.
I'm sorry, we lost audio for a second. Who made that motion?
Ibarra.
Thank you. And seconded?
Me,
It was a tie
David.
between Carol and Davis.
Thank you. Motion by Mayor Pro Tem Ibarra, seconded by Councilmember Davis to approve the agenda. I'll call the roll. Mayor Lopez,
Yes.
Mayor Pro Tem Ibarra,
Yes.
Councilmember Davis,
Yes.
Councilmember Menke,
Yes.
Councilmember Gonzalez.
Yes.
Motion carries.
Now we will take public comment from members of the audience. If you would like to provide public comment through Zoom, please click the raise hand button. At this time, the public is encouraged to address the City Council on any matter that is within the subject matter jurisdiction of the City Council. The public will also be given a chance to comment on matters which are on the posted agenda during City Council deliberation on those specific matters. Is there any public comment?
Mayor, there are no attendees with their hands raised, but I did receive emails. One from Jonathan Hawes, and I'll read that. Good evening. My name is Jonathan Hawes. I served as El Monte City Clerk from 2013 to 2018. Since 2015, I have been a whistleblower on Andre Quintero and Team El Monte's embezzlement of $10 million from the El Monte Promise Foundation Scholarship Fund. I have interviewed dozens of El Monte residents who have privately confirmed that Promise funds were used for fraudulent trips to Vietnam and Haiti, a bogus consultant in Salt Lake City, house repairs, and other criminal activities. I have myself been interviewed by the FBI about 24 times. Documents proving the embezzlement have been submitted to the FBI and the District Attorney's Office and are now available to the public online. I am asking the Vernon City Council to call out these crimes and protect the vulnerable residents of one of the poorest cities in Southern California. El Monte children who should have been provided with college scholarships were robbed. Andrew Quintero and Team El Monte members must go to prison. If you have any questions, please call or text me at, and then his phone number. Thank you. Mayor, I have another comment. It's regarding item number 1, if you'd like me to read that now.
Sure.
Honorable council members, Square H Brands, a longtime business citizen of Vernon, supports any active role played by the city to help alleviate the COVID-19 virus. Although the presentation on today's agenda covers the possibility of establishing a testing site, in our opinion, the most valuable application of city resources would be toward the establishment of a vaccination site. Many businesses and employees in Vernon are classified as essential by the CDC and will soon become eligible for priority vaccination. Creating an efficient path for essential employees to be vaccinated on a timely basis will be crucial to the health and welfare of these employees, those employees, their employers, as well as the entire population of the city of Vernon and surrounding communities where many of our employees call home. Thank you for your consideration. Henry Haskell, President and CEO of Square H Brands, Inc. Is it for public comment and the email provided for item number 1? So if you'd like to move on to item number 1, we can proceed.
Okay, we will now go on to the presentations, item number 1.
Item 1 is plan to establish a COVID-19 testing site in the city of Vernon, and Health and Environmental Control Director Adrian will present the item.
Thank you. Good morning, Honorable Mayor and council members. My presentation this morning is to brief you and kind of give you a recommendation of establishing a COVID-19 testing in the city of Vernon. So when our city administrator reached out to us to see, look into it and see how we can bring something like that to Vernon, we reached out to LA County Fire, who has originally was the one doing the testing for the county when COVID testing came on board. And they did refer us to a third-party company that they have used, which we reached out to them to kind of understand and get an idea about how to set up something like that in the city of Vernon. We also did reach out to Stacy Medical, who is located in the city of Vernon, that basically do most of the testing, COVID testing for businesses when they need to get COVID testing done, except Farmer John, who have their own on-site nurses that do the testing on their behalf. So based on that, what we were able to establish was, yes, the city can establish a testing site at the location. However, to do that, the city will need to open that testing or make it available to everyone. So not only LA County residents, but anyone that wants to get tested, the testing should be available to them for them to do it. The city will be responsible for payment if it's a non-LA County resident or the person may be uninsured. And the challenge that we learn about that is when you do online registration, we're told that sometimes people just skip the part that says if they are insured or not. And basically, if they are not a LA County resident, the company cannot recoup their costs. So the city have to make that payment if they can't get their money. So, and then they break down the cost if the city wants to do that. So in this particular company, they charge us $65 per test, and then additional $4.50 to send the result to the patient. That $450, $4.50 will be, the city have to pay for that. That is not included if they have to even bill the insurance or bill the county based on the CARES Act. So that will be a cost that the city have to bear. In addition, if they have to support us to do that work, it will be $1,500 for 8 hours to support us doing it. So even if we do 4 days a week, it equates to almost $24,000 a month to have them supporting us, plus additional staffing if they need to bring more staff. So with that, we looked at what do we currently have in the city or what resources available and what are the options that we have within us right now. So one of the things we did reach out to Stacy Medical. It says if city residents are interested in getting tested for COVID, they're willing to have residents come and get tested and it will be at cost. So they won't charge anything extra. Obviously, if they do have insurance, they can bill their insurance company also. All residents can go also to their own provider to get the testing done. The other thing also with the Cal OSHA emergency temporary standard that was became effective last year, later in the year requires actual businesses, if there's a COVID-related issue at work, example, an outbreak, that the business have to provide testing for the employees. So they're on the hook to make sure that they're providing the testing and they're paying for that testing. So that is another thing that is available right now, that employees in Vernon can have access to testing if it's COVID related. And obviously, if it's not, also they can go to their primary provider and that can be provided to them at no cost, or they can go to a city or a county testing site to get that also done. So with that, what staff recommended to the city administrator was based on information that we gathered, especially right now, we're diligently working with Stacy Medical to be able to, and LA County Public Health, to be able to secure and administer COVID vaccine at work site. So our goal is to really, when the next phase come up and the vaccine available, the uniqueness of Vernon will be able to go actually to the work site and do the testing on site. And then when the next phase becomes available, where it will be available for mass vaccination, we're able to set something up in the city to be able to provide that. So with that and the resources that may be needed, which we're still working through, because if we're gonna do mass vaccination in the city, I think it will take considerable resources on the city side with Stacy Medical and businesses. So with that, we think setting up a COVID testing right now is something that we recommend city council to maybe hold off, and let's get the vaccination thing squared away and let move on that. So with that, I'll stop and see if council have questions.
Does the council have any questions?
Freddie, I do. Thank you for the presentation. So it's not, are you saying that it's not financially worth it for us to open a testing site?
Yeah, right now, if we do, because since we have to open it for everybody, it may be very cost prohibitive if people decided, because they're closing some sites already. And the idea is, people can go to their primary care to get them if they need it. So if you open it up for everybody, there's a possibility that, yes, we may be paying for the ones that don't check the box that they are insured, they don't provide their information.
Okay. Thank you.
I know some testing sites, they ask if you have insurance and then they take your insurance and then they try to charge your insurance afterwards. Is that an option?
That is correct. And that's what they told us, that because most companies, to be efficient doing this, you pre-register online to get an appointment to kind of get done. And what they've learned is people skip that insurance part. They don't. So when they come in and they have to get tested, they typically don't ask them because they already skip or they answer that question already.
I know, like
Freddie,
my dad went to go get tested and we had to pay a fee up front, and then they tried to get that reimbursed by the insurance, but we did pay the fee up front. So is that also a possibility that we can charge, but then we try to charge their insurance, and like that people will be more apt to provide their insurance?
Mine is so this company, they don't, the one LA County use, they don't do the charge up front, but if you go to somewhere like Stacy Medical, yes, you can pay and then they will bill after the fact.
That's what I was
What I
mentioning.
alluded to earlier was with the Cal OSHA emergency standard, businesses, like similar to what you said, have to pay for that, and then they can bill after the fact, but it's on the business to make sure that the testing is done. So right now, they kind of have a mandate to test employees already.
Okay.
Freddie, I have a question. Maybe you can bring this at the next meeting or just email the data. If you can reach out to Huntington Park, Bell, and Maywood, I know they do have some pop-up sites. I want to see what the cost was on one of their sites. I think Huntington Park had one only for like 3 weeks. Bell has pop-up sites here and there, and Maywood as well. So I just want to
Yes.
see what the cost for them has been, either whatever the range, if you can just like do a 2-week range, I want to see what the cost was to them.
Okay, I'll reach out to them and get back to you.
Thank you.
Thank you, Freddie. I was just wondering, I think we've missed the boat on the testing. But moving forward regarding the vaccine, is there any way we can partner with the mayor of Long Beach? It seems that they've been very successful in setting up vaccination. They have their own health department, just like we do.
Yeah, so the way it works is, well, the first answer is no. Partner of Long Beach, we can learn from their expertise. However, the way the distribution channel is right now is you go to the state and then you go through counties, and county have the discretion how much they give to pop-up or any city if they do have a vaccination site. So for example, Vernon right now in the phase, let's say we put in for 10,000 doses. The county still has a discretion of giving us 10,000 or not. It's on the county discretion, and the state have made that clear. So we have worked with them to make sure, because locally in Vernon, we have the Pfizer freezer in our trailer that the USC was supposed to use. So we think that's an advantage to us, that we're able to take the Pfizer vaccine. However, with that said, with everything, registration and getting all that set up, and then adding a 65 plus over to that list, our conversation with the county kind of pushed everything back, where when we're looking at somewhere mid-February getting this going, they're looking at maybe March or April. So once we get that going, we've been pushing on the county. We want to go to the businesses, because we know how impacted it is to them, and sending them even to, if we do a mass vaccination in city, let's for example, City Hall, then you open up to everybody. So trying to check, who is a city employee and that works in Vernon, who is not, that becomes a little hard. And then, it's best of first come, first serve. But if we target the businesses where they register as a group and go on site, not only we think it's more efficient, but also we're not gonna, we don't want to waste any drop of vaccine if we don't have to. So we know exactly who's taking it and how. So what we have done is we send surveys out to businesses to kind of give us a ballpark what the uptake will be, and that will inform our decision when we start asking for vaccine.
This is my understanding, since we have our own health department, we can set it up however we want, right? If we just wanted to go to the businesses and the residents, we could do that, right? We could just accept people who live and work in Vernon, right?
Right, we can. However, LA County was very adamant about us not jumping the line. So for example, whatever phase we're in, they want us to be in that phase. That was actually their biggest concern. That and I think you see on the news where Long Beach is ahead doing food employees, they were not up to that. They don't want it, because I think they think it causes confusion, because the people are doing their own thing. So our goal is we want to stay in line with that schedule. However, we want to be more efficient. And, like we brought it up, there are folks that work at 4 a.m. to 2 o'clock. And when they get off, it's hard to go to a mass vaccination site to get it, where if we can bring it, I think we'll be more efficient.
And then also a lot of places are being, told that they're going to get a certain amount of vaccines, but at the end they get very few vaccines, right? Because there's a shortage.
Yep. So for example, to give you a number, our LA County was receiving about 166,000 doses per week. And this was before they added the 65 plus to that list. And when they did that, within the day, added over 1.5 million people additional, but there was no additional doses added. So that, again, do the math, kind of not shorten, how many people can get it. And then on top of it, like you were saying, even the 165 on average, sometimes they get 144,000 based on how the shipment comes in. So the whole thing everybody's hoping for is hopefully there'll be more vaccine available. I think you saw in the news that Johnson & Johnson is coming up. They should be going to FDA, I think, next week or in 2 weeks to get that approved. And that is a 1 dose instead of 2. So, and I read it, I think they're willing to actually ship out as soon as they get approved 100 million doses. So with those kind of help and stuff that they come on board, I think that's gonna really help alleviate the shortage. But right now, the county, the second doses, they actually sending emails out to people that are due for second that it may take additional 2 to 3 weeks to get their second dose.
Mhm.
I mean, I was fortunate enough to get the vaccine. Dennis, on the other hand, we've been unable to make any appointments. So there really is a shortage. If anybody's tried to do it, it's almost next to impossible to get an appointment now.
Yeah, like I got my vaccine and I'm supposed to get the second email, but I haven't even gotten the second email yet. So I think I'm just gonna show up. So there is some confusion as to what's happening. And I know that everything rolled out really quickly. And I don't think that they thought of all the kinks that were gonna happen. So I think that they decided to roll out the emails after the fact, because I heard about it after I was vaccinated. So for the first dose. So yeah, it's something, it's a learn as we go type of thing because it's brand new. So I think that, yeah, I mean, I hope we're able to get the 10,000 that they're telling us we're gonna get.
Letitia, can I
what-
ask you, did you have any side effects at all? Because I had none. Nothing.
None
Okay.
at all.
Just to encourage everybody, when you can get the vaccine, it's good.
Yeah, when they said essential workers, I signed up immediately because now they've pulled back on that, you know?
Yeah,
so
because I'm
it's
Dennis's
on
home
age.
health care person, so that's how I was
Yeah.
able to get it through Kaiser, but
And something to also consider that they realize that the 65 plus, the uptake is really high.
Right.
When they were doing essential workers, I think it was with around 45, 50% that was taking it. So that's why it was available. But 65 plus,
90%.
almost everyone wants to get it. So
Right.
that also now is stretching how much is available, which is
Well,
actually, we think it's a good thing that people wants to take it.
Right, right. I hope that it really motivates people, you know, when they hear that there's no side effects, you know, everyone's doing okay afterwards. So I hope that that motivates people to go get it.
Freddie,
one
quick
last-
question. If we were to get all the vaccines here in Vernon, who would be doing the administering of it?
So that would be Stacy Medical. So another thing that I didn't mention, I mean, getting the state registration, I won't say it's a nightmare, but it's challenging. First, you have to register with the state. So that's why early on, around December, late November, I started having that discussion with Stacy because we needed, because they're already doing flu shots. So we thought they were already in the system. It was easy to partner with them, somebody that already doing it. And then through that process with LA County, we're going through one system that the state had. And then right in January, they decided to switch a system. Some of the information I was already putting, they didn't transfer over, so it wasn't getting approved. But when we do get them, the administration will be in partnership with Stacy Medical. However, we have some doctors that have reached out to us, they want to volunteer. So I think the on-site one will mainly be Stacy, but when it comes to, if we do move to the phase where we can do mass vaccination, we're probably gonna bring extra help, nurses in, city staff is gonna be supporting. So there's gonna be a collective effort with businesses because they have the volunteer people to check them in, people to check the line, people to check people's appointment and all those work.
And I
I
also
would-
believe LA County Fire has also added their assistance.
Yeah, I went to the Downey of Education and it was super efficient. They were very, very good. I didn't have to wait very long. It was in my car. They had a nurse making sure that everyone was okay after they make you stay for 15 minutes to monitor you. And it was very efficient. And they made sure that, you know, you had an appointment. So it was really good. I know I heard other people who went to Dodger Stadium and the wait was like 3 to 5 hours. So yeah.
Yep,
It's,
and I heard there was restrooms issues, especially, you know, people stay in their car for so long. So those are things we will try to avoid when we do get there. We have lessons learned. I've gone to some pods to check out how they set up. So if we do start doing that, but like Carlos mentioned, you know, having fire and I also for PD, it's Chief Miranda has, you know, willing to also help us out to do that when that comes about.
I know when Downey Public Works was like, you know, shuffling cars, telling them where to go and, you know, helping out with the whole thing as well.
It's a team effort, really.
Mm-hmm.
But Freddie, that is one you should check out. I've been by that one several times and it is very efficient. It is so well set up and well organized. That's one that I would recommend you look at. It's
Okay.
bigger than what I think we could have here, but it would still be a great example of great logistics.
We do. Thank you.
Councilmember Ibarra, did you have a question? I thought I heard you. I'm sorry.
No, it was
Okay.
just
Okay,
planning.
is there any further questions by council members? No? Okay. So we're gonna, thank you so much, Freddie, for all the information and for answering all of our questions.
No, thank you.
We will now go on to the consent calendar. All matters listed on the consent calendar are to be approved with one motion. Items may be removed from the consent calendar by any member of the council. Those items removed will be considered immediately after the consent calendar. Does council wish to pull any items from consent calendar?
I'd like to pull number 2.
Okay, are there any public comments for the consent?
Wait.
Out of way. Yeah,
I
I would like-
would number 7, Minky.
I would like to pull number 8.
Number 7 and 8.
So we're
Go ahead.
pulling 2, 7, and
7
8.
and 8, right.
Okay. Oh, not 1. Okay, 2, 7, and 8. Okay, so can I have a motion to approve items number 3 through 6?
I move.
I'll second.
Second,
Motion by Councilmember Davis, seconded by Councilmember Menke to approve the consent calendar with the exceptions of item 2, 7, and 8. I'll call the roll. Mayor Lopez,
Yes.
Mayor Pro Tem Ibarra,
Yes.
Councilmember Davis,
Yes.
Councilmember Menke,
yes.
Councilmember Gonzalez.
Yes.
Okay, we will now go on to item number 2 on the consent calendar.
So Lisa, I just basically had a question as to why are we changing this, that we're gonna skip the second readings?
This item doesn't skip the second reading. What it does, it allows us to not have to read the entire ordinance in its entirety. We're required to either waive full reading of the ordinance or read every word of the ordinance itself.
I don't remember ever you guys reading the entire ordinance.
There's a couple ways to do it. You can have an action on the item itself, which is probably what we'll do in the future. To the first action of the council would be to waive full reading and then introduce and or conduct second reading of the ordinance. It's just a technicality that allows us to not have to read the full ordinance.
Mayor, if I can also address that issue briefly.
Sure.
Yes, and as the city clerk indicated, this will not eliminate the second reading. So there's still the requirement of the introduction of the ordinance, the second reading, which is the adoption of the ordinance, and then it takes effect 30 days with some exceptions. It does, however, waive or not require every single word to be read. Most cities will do that because some ordinances can take a half hour just to read. So that the reason is for the efficiency of the council's processing of these ordinances, but it still is a requirement that you have first reading, second reading, and then it takes 30 days for adoption.
Thank you for the clarification.
Okay, now we will go on to item number 7.
Mayor, if we can get a
Yes.
motion to, if we could get a motion to approve item 2?
Each individually? Okay. So is there a motion to approve consent calendar item number 2?
I'll move.
Menke second.
Motion by Mayor Pro Tem Ibarra, seconded by Councilmember Menke to, after the city clerk has read the title, waive full reading of ordinances considered on this agenda. I'll call the roll. Mayor Lopez,
Yes.
Mayor Pro Tem Ibarra,
Yes.
Councilmember Davis,
Yes.
Councilmember Menke,
Yes.
Councilmember Gonzalez.
Yes.
Motion carries.
Thank you. We will now go on to item number 7 of the consent calendar.
Item 7 is amendment number 1 to services agreement with Southeast Rio Vista Family YMCA.
I just had a couple of questions on this. Number 1, is the financial impact going to be the $125,000 again? That's my first question.
To answer your question is so far on last year's contract, we spent $7,194. So we didn't use all the funds that were allocated in last year's contract.
So it's just rolling over then, basically. Is that correct?
That's correct, Councilmember. We're just requesting to roll over the contract.
And the other, it's a suggestion that we can bring up later, perhaps. I know that YMCA is providing some food to disabled and elderly residents. It's greatly appreciated. But I was wondering if maybe we couldn't partner somehow with our restaurants in the area and do maybe something twice a week to help them in partnership with YMCA, perhaps. I don't know. It's just something to think about because I know all the restaurants are struggling, and anything that we could do maybe, to provide, I don't know how many people they're providing services to, but maybe to provide 1 or 2 meals a week or something that would help our restaurants and our citizens. It's just a thought.
Okay, I can go back and evaluate that with staff. And are the intentions there to use the community benefit fund in order to fund a program like that?
I think that I'd leave that up to you, Carlos. I'm really not sure whether we would utilize what's left over, part of what's left over with YMCA if we partnered with them, or do it separately. So I was just thinking it might help everybody.
Okay, we'll go back in and evaluate that, and then I'll report back to council.
Thank you, Carlos.
Carlos, I have a question. We spent 7,000 with them since starting February last year. What was the 7,000 spent on?
I believe those were for initial memberships for families that started out with the YMCA. So if you remember back, I think it was February, or I can't remember the month, but it was prior to COVID. It was the actual memberships to start up with the YMCA for certain programs.
Since COVID shut YMCA down, are we able to extend those memberships to our residents without paying the next annual fee?
Yes.
Is there any further questions for item number 7? Is there a motion to move item number 7?
I'll move.
I'll move. Second. I'll second.
If you could just state your name instead of saying I'll move, it would be much easier. So I have.
Menke move.
Thank you. Menke.
Ibarra, second.
Thank you. Motion by Councilmember Menke, seconded by Mayor Pro Tem Ibarra, to approve and authorize the city administrator to execute amendment number 1 to the services agreement with the YMCA Metropolitan Los Angeles Southeast Rio Vista Family YMCA. Mayor Lopez,
Yes.
Mayor Pro Tem Ibarra,
Yes.
Councilmember Davis,
Yes.
Councilmember Menke,
Yes.
Councilmember Gonzalez.
Yes.
Thank you. We will now go on to consent calendar item number 8.
Okay, so I have a few questions. On number 8, Why is this under city clerk? Why isn't this under public works like it used to be?
This is the first time this item's been on the council agenda, and we're just bringing it forward as a receive and file so that the council can see the report that was provided to the Housing Commission. I input the report into the system. That's the only reason it's under city clerk. And it was a matter of timing because the meeting was on Wednesday. So I was trying to get it into the packet quickly. But it's really
Okay.
a public works item, and Dan is prepared if you have any questions.